So we talk a lot about self-management with diabetes. So what are the main things we have to think about with self-management diabetes? It's pretty simple. It's the ABCs of diabetes. The three things that you have to take care of. A is your A1C. That is the measure of the control for your blood sugars. So that's your A1C, HbA1c. The B is your blood pressure, because this does matter, particularly if you have type 2 diabetes. Blood pressure is considered a risk factor for increasing your cardiovascular risk. What do we mean by cardiovascular risk? Cardiovascular risk means the risk for heart attacks, risk for strokes, and we don't want to increase that risk, so we want to keep the blood pressure under control. So that's your B. And C is your cholesterol. We've all heard of cholesterol as being a risk factor for increasing the risk for heart attacks and strokes. So you want to keep your cholesterol under control. These ABCs of diabetes are the fundamentals of taking care of yourself. The A1C generally is recommended to be less than 7%, but those numbers can be individualized, particularly in those patients who are elderly, who have a lot of hypoglycemia, who have underlying cardiac or heart disease. There, perhaps the targets can be a little bit looser. B is your blood pressure. The target that we aim for as physicians generally is less than 130/80. C is your cholesterol, and here we are talking about the bad cholesterol, sometimes called the LDL cholesterol, and that number should be less than 100. And these three are the main targets that we want to address when we have a patient with diabetes. And those are the targets that you should look at and say, am I at those numbers? Am I at my A1C close to 7%? If I'm not, then you have to have a discussion with your physician as to what that number should be, because there is now recommendations coming from the Diabetes Association that those numbers, the A1C, needs to be individualized. What we don't want is low sugar reactions. B, again to re-emphasize, is your blood pressure. That number should be less than 130/80. And C is your LDL cholesterol. That number should be at least less than 100. And these are the discussions when you go to see a physician you need to have with them. Am I at my numbers for the A, B's, and C's?